Hello, humans. This is the second in a series of what I think will be three um, videos about how they did acumoxa and so forth in ancient times. Last time it was focused on acupuncture. Today we're going to talk about Moxibustion and bleeding therapy, bloodletting. So let's see. Um, the old books, just like that list the needling depth and needling retention, that also list how many cones on each point. Here I'm talking about books that go over the points one by one. There are a number of ancient books from Zhenzhou Jiajing to Tongren and so forth. But here I'm going to use Zhenzhou Dacheng because that's the book I most often go to for information. So here are just some samples. I didn't list every single point and how many cones of moxa it says. Sometimes it would tell you that a point was contraindicated for moxa. Sometimes it would tell you that this book says this many cones and that book says that many cones. But it would generally then list what the author thought was appropriate. And so I should point out, this is talking about probably direct moxa. Direct moxa is the oldest method and has been used since, pre-Han times. And then that could be grain of rice, tiny cones, or that could be relatively large cones that are definitely going to leave a burn. If you use grain of rice cones, you don't have to leave a burn mark, but if you're skilled. So then in maybe about 300 something CE, Zhouhu Beiji Fang is the first book that we have that talks about indirect moxa, moxa on ginger or garlic or salt. And that was written by Ge Hong. Moxa sticks were not invented till the Ming Dynasty. And so this is a Ming Dynasty book, and moxa sticks did exist. He had one passage about moxa sticks in Zhenzhou Dacheng. The author is Yang Jizhou. But in general, he didn't talk about it because it was a very special technique that was reserved for special circumstances. And so here he's talking about, it's not clear, is it direct or indirect, but it's probably direct, or he would say otherwise. So anyway, each point lists a number of cones per session on each side. So if you're doing lung one on bilaterally, you do 5 cones on each side. LI4, 3 cones on each side. If you're going to use Ren 17 for moxa, 7 cones on Ren 17. You might notice that these are all odd numbers because odd numbers are yang, and moxa is a yang thing. And so generally they had odd numbers of moxa cones listed, and pretty much the points would say 1, 3, 5, 7, or 9 cones. That's in the list going over the points one by one. However, there are other styles for choosing the number of cones that we can find in old books. Often they specify a multiple of 7. So it might be 3 times 7 cones or 7 times 7 cones. I personally think this meant 7 cones a day for 3 days, or 7 cones a day for 7 days, or something, whatever. And there is some evidence for that, although I'm not presenting it here. So you could just say 3 times 7 is 21 cones and do that in one sitting, but I actually think they meant 3 sessions with 7 cones each session. And when they did this, it's almost always 7. They don't say 3 times 9 cones or 3 times 3 cones. Usually they use 7 as the multiple. Okay. Also, though, they use multiples of tens, but they wouldn't say 2 times 10 or 5 times 10. They'd just say 20 or 30 or 100 cones. So if you needed a larger number of cones, sometimes they'd say 10 cones. But, if they were talking about a larger number of cones, they'd use multiples of 10. Another method of saying how many cones, which you really only see in the very old books or quoting from a very old book, is using the same number of cones as the age of the patient. So if the patient is, 27, you would use 27 cones of moxa. You come across that occasionally, but I don't think it was real common. And then there are some doctors who really went for heavy moxa and use a lot of moxa. Of course, if somebody's severely deficient or had certain types of diseases, maybe you do want more moxa, but many doctors would only ever use like 3 times 7 cones. Something like that might be their maximum, but other doctors frequently say 100 cones or 300 cones or even 1,000 cones. You see this in Chen Jin Fang by Sun Tzu Miao, not every time, but frequently enough. And you see this in Do Tsai, who wrote a book called The Book of Bien Chui's Heart. And, so there's some doctors who favored a lot of moxa. This could be done in sessions too. So, for example, 30 cones a day for 10 days would make 300 cones. And so that's probably also what is done more often than just doing 500 cones in one sitting. That would take all day. But in emergency cases, they might just say, don't count the number of cones. And what that means is just keep doing it until the patient revives. Don't stop, just keep doing it. If they don't revive, but you've burnt them, if they die, but you've burnt them, it's not a big deal. You didn't kill them. And if they do revive and you've burnt them, I think they'd still rather be alive and recover from the burns than to be dead. So, in really emergency situations, they would just keep doing moxa, just kind of like we're told with CPR, just keep doing it. Don't stop unless the patient revives. Okay, so that's kind of the ideas that you'll come across in the old books for the number of cones. As I said, they didn't have moxa sticks, or moxa sticks weren't common until even the Qing dynasty or the 20th century. And so the old books don't tell us, how long to do moxa sticks for. They even had a different technique for moxa sticks, but that's another session. So I have a couple sample cases from Zhenzhou Dacheng that involve moxa, although they may be doing both acupuncture and moxa. So let's see how this goes. Zhenzhou Dacheng has, I forget if it's 25 or 30 cases, but something in that range. The author, Yang Ji Zhou, these are his own personal cases. So in 1572, old Mr. Yu from a certain office had diaphragm qi and marked emaciation. So diaphragm qi means there's a feeling of blockage in the throat or esophagus, and so you can't swallow. And since you can't swallow food, then he can't eat. And so now he's emaciated, or he can only eat very little, or he can only maybe drink some liquids. So he's really emaciated. And generally, this is thought to come from liver qi constraint. But it also makes it hard for the patient to swallow herbs and probably can't swallow pills at all. And besides, when you're really, really weak, sometimes you're too weak to take herbs. That's a principle. So he can't swallow dysphagia, and he's very emaciated. It was difficult to cure him using herbs because he can't swallow them and he may be too weak for herbs. By the way, Yang Zhou used herbs in acupuncture and moxa and all of it. He wasn't specifically an acupuncturist, but he felt that there was not a good enough acupuncture book, so he wrote this. But he used herbs frequently in Zhenzhou Dacheng. So this Mr. Yu summoned me to see him. His pulses were deep and rough, 6 pulses, because 3 on each side. And so I needed to select Ren 17 to harmonize the diaphragm. And I also selected Ren 6 to safeguard and nourish the source. So one point is treat the root. I guess you could say that, Ren 6, and the other is to treat the symptom, Ren 17, although they both will work together for both things. Ren 6 will help descend chi as well as Ren 17, and Ren 17 can help with supplementation. Anyway, if I do these 2 points, then his original chi will fill out and his pulse and breathing would naturally flourish. So I do want to point out that here, when he says original chi, that's not the same as kidney source chi. This yuan chi is, a term that Li Dongyuan used quite a bit, one of the 4 great masters of the Jin Yuan dynasty, and he used it kind of to mean post-heaven chi or right chi, just the chi that's going to make me healthy or keep me healthy. So that's his point selection, just 2 points. I chose a suitable time for acupuncture because they had certain days when acupuncture was prohibited, and I don't know when the suitable time was, but it could be he chose a time when he had some method of saying Ren 17 and Ren 6 are open at this time, but he doesn't write about any method like that. So I think he's just choosing a day when acupuncture is auspicious. I needled the upper point, Ren 17, and manipulated it 6 times, whereas Ren 6 will be 9 times. So these 6s and 9s are numbers that are associated with the I Ching. 6 is a yin number, being even. It's kind of maximum yin in certain I Ching ideas, and 9 is maximum yang in certain I Ching ideas. But 6 also represents draining technique, and 9 represents supplementing technique. So he's draining Ren 17 because there's an obstruction and you want to drain the obstruction. He needled and did that 6 times, and then he manipulated the lower point, Ren 6, 9 times to supplement it, a yang number. Then he applied 7 cones of moxa to each of those points, and Mr. Yu totally recovered after that. So now he's gotten promoted. He's the prefect of Yangzhou. He's healthy enough to go do his job. And in 1580, which is 8 years after this treatment, Yang Zhou, I passed through this place called Yangzhou where he was, and I observed him, and I saw that, he physically looked really full and healthy. So it's pretty dramatic. It sounds like it's just one treatment. It could have been multiple treatments, but wow. Okay, and you can see he combined acupuncture and moxa. It seems like he did acupuncture first and moxa afterwards. Let's look at another sample case, also from this same section of Zhenzhou Dacheng. In 1574, somebody's father, Mr. Qian's father, he was like a trainee or an intern, it suffered from a disease of the spleen and stomach. And so he was recovering near the altar of heaven. So that's someplace in Beijing. Yang Jizhou's in Beijing at this time. But where they were living was several li from his house. So if I understand correctly, a li is a third of a mile. That's some distance if you're sick. If it's, 3 li, that's 1 mile. So the son arrived with his father for each appointment, really trying to be filial. He didn't just say, okay, dad, take a taxi and go to your appointment. That you could hire people to carry you place to place, but he escorted his father because filial piety is a really important value in Chinese culture. I was touched by his sincerity and that he did not dread how far he had to bring his father. So I rushed out to welcome them whenever they came. This sentence, I had to ask someone who knows a lot more than me about it. This person is just an observer, he's an intern, and the father hasn't yet passed exams either. So Yang Jizhou has a much higher rank. Generally, if you have a higher rank, you'll sit in your office and wait for them to come to you. But if the person has a higher rank than you, then you'll go out to meet them and greet them. And because Yang Jizhou is so moved by the son's filial piety, then he treated these people as if they were his superior. Okay. So I told them the spleen and stomach are the root and the stem of the entire body. They establish the foundation for the 5 elements, and they're the mother and father of the 10,000 things. Spleen and stomach make post-heaven chi. They give us life in that sense, or they keep us alive. So shouldn't we do our utmost to fortify them and promote normal ascending and descending and so forth? If they're not fortified and if they don't move normally 100%, then deep-rooted disease is certainly going to occur. So Mr. Chen's father, his disease did not occur overnight. This has been going on for a long time. The spleen and stomach are deeply unhappy. However, the spleen likes sweetness and dryness, and it dislikes bitterness and dampness. If you give herbs that are too hot, they're going to disperse the flesh. Spleen governs the flesh, and you don't want herbs that are too hot because they heat radiates outward and dissipates. When herbs are cold, they decrease the appetite, so people aren't eating and drinking so much. When a doctor treats a patient for a long time with herbs and doesn't get the results he should, there's nothing better than early application of moxa to 2 points, Ren 12, and a non-channel point called Shirtsan, which I'll talk about. Okay. So he's saying, the spleen and stomach are really damaged, and herbs can also be damaging. And so we're going to do something different that won't tax the spleen and stomach further. So this point, Shirtsang, literally means food granary. It's a non-channel point. If you have acupuncture comprehensive text, it's MCA 6. CA stands for chest and abdomen. And M means it's an ancient non-channel point. N would be a new point. CA is chest and abdomen, so we know it's on the chest and abdomen, and it's the 6th point in that section. So it's located 3 Tsun lateral to Ren 12. Stomach 21 is 4 Tsun lateral. This is 3 Tsun lateral, to I'm sorry, stomach 21 is 2 Tsun lateral, and this is 3 Tsun lateral. So it's a little outside of the stomach channel. It treats spleen stomach disease, for example, non-transformation of food, which means undigested food in the stool. Dysphagia occlusion, which is, again, difficulty swallowing because there's a blockage there. Stomach reflux, stomach spasms, and so forth. Unfortunately, Yang Jizhou didn't have an entry for this point, so he mentions it in 2 cases, but in the section where he talks about non-channel points, he doesn't discuss this point. But we know he likes moxa on this point in cases like this. In both cases, when he uses it, it's combined with Ren 12. So they gladly agreed to moxa. I applied 9 cones of moxa to each of these points. 9 is a yang number, 9 is supplementing. In addition, I needled them, manipulating the needle 9 times the number of yang. Moxasaurs developed because this is direct moxa, and he wants moxasaurs because in the old books it was thought that that was really an important aspect of getting things done. And it probably can be beneficial because the point is still being stimulated until the moxasaur heals. But this is why he asked for their agreement, is because he was going to make moxasaurs. Mr. Chen's father improved little by little. So now the son he's no longer an observer, but he's got the rank of supervising secretary for the Office of Scrutiny for War, whatever. And his father, even the one who was sick, and his younger brothers since then have passed the imperial exams, and they're vigorous and strong. So, people often, like, the exams were only every couple of years, and sometimes people would take them again and again for 10 times or whatever. So, his father was still trying to take the exams and finally passed. And Yang Jizhou is trying to take a little credit for the father passing, for the whole family passing exams. Anyway, so that's another case. You can see not many needles, combine using moxa, and so forth. So I'm going to move on to bleeding technique now. It was much more commonly used in the past. It's discussed a lot in Neijing, and all the old acupuncture books talk about it frequently. Case studies, you see it. Actually, there are more case studies that have bleeding therapy in it. If you're just looking around for case studies, there are fewer case studies that are like acupuncture related, because a lot of the old herbalists also did bleeding and also did moxa. But many of the old herbalists didn't really do acupuncture with a fine needle. So anyway, here's a little story. Well, first here's lung 11, Shaoxiang. It's suitable to prick with a 3-edged needle and let out a tiny bit of blood. This lets heat out of all of the zong organs, heat that's accumulated in the yin organs, but this is not a moxa point. There's some other stuff about needling here, but I just wanted to talk about, there isn't, yeah. Actually there is, but I didn't put the Chinese in here. Okay. It says it's not suitable for moxa, but this actually is a moxa point when you're expelling ghost evils. But that's a whole nother story. Anyway, so it's got a little historical tale here. Prefect during the Tang Dynasty, Mr. Cheng suddenly suffered a swelling under his chin that was as large as a sheng. It blocked his throat, so he couldn't swallow water or food for 3 days. So Zhen Quan, who was a famous Tang Dynasty doctor, pricked this point, lung 11, with a 3-edged needle and let out a tiny bit of blood, and Cheng promptly recover. Then Yang Jizhou adds, this point drains heat from the zong, which, he set up there. So that's an example. Here is a specific example that's discussing bleeding therapy on points around the eyes. Okay. He says, Yang Jizhou says, when you prick the Taiyang and Yangming channels to let blood, the eyes get brighter, which means it improves vision. Okay. These channels have a lot of blood, but not so much qi. So Actually, the Yangming channels have a lot of qi and a lot of blood, but the Taiyang channels only have a lot of blood and don't have much qi. These ideas come from Neijing. It's mentioned in a couple different places. And so Taiyang and Jueyin channels have a lot of blood, but not much qi. Yangming has a lot of both, and all the rest have a lot of qi, but less blood. So since these channels both have a lot of blood, then you can prick them and you won't harm blood. If a channel doesn't have much blood and you bleed it, you may make that channel deficient. So we only want to bleed channels that have lots of blood in them. So these two plus Jueyin, although we're not talking about Jueyin in this passage. Okay, so when eye screens, which means something like cataracts, with redness and pain arise from the inner canthus, because they're talking about UB channel, so inner canthus, prick UB1 and UB2 to let heat out of the Taiyang. And here they mean prick to bleed. So prick UB1, 1.5 fun deep. A fun is a tenth of a tsun. And prick UB2, 1 or 3 fun deep. That's how deep. But now he complains about modern doctors, which he publishes in 1601. So he's talking about 1601 doctors, but I think he could also be talking about others. He said, today doctors, needle UB2, transverse needling straight down to UB1. They're just like following the channel from UB2 to UB1 with a fine needle. And then they don't supplement or drain. And then they retain the needle for a long time. This is not how the ancients did it. The ancients bled these points, he's saying, and he disapproves of the modern methods. As far as retaining the needle for a long time, he doesn't say what that means. But we talked about needle retention, in like the previous one. So, okay. So certain points, some doctors feel you should really bleed them and not needle them. This picture doesn't exactly go with here, but I'll talk about the picture in a minute. Here's another example. UB40, Wei Zhong is, it's got an alternate name. Many points have alternate names. Its alternate name is Shui Xi, the blood Xi cleft point. And he says you can bloodlet, and intractable diseases, chronic long-term diseases that you just can't get rid of, will all recover. For cold damage with heat of the 4 limbs, or febrile disease with absence of sweating, remove the channel blood and the patient will immediately recover. Okay, so it says cold damage, and you might think that means the patient is cold, but actually cold damage, starts with Taiyang where the patient is cold, but then it goes to Yangming where the patient has heat. And a lot of the other levels of cold damage, Shanghan, a lot of the other levels have heat. So he's not talking about pricking it when wind and cold invades. He's talking about later when there's heat. So, and especially, febrile disease without sweating, then you can bleed. This isn't actually UB40. I think that's the inside of the elbow. I'll talk about it in a minute. So bleeding therapy. I know a lot of people are afraid of it. It's not painful, except the Jingwell points are pretty painful, but otherwise it's usually not painful. Secondly, a lot of people say it's illegal in California. That is not true, but this isn't about that. And then this picture I got, from a Chinese webpage. I think it's the inside of the elbow. And here it says this is sick blood. And here it says this is good blood. And I just briefly want to talk. There are 2 main types of bleeding as far as I can see. If somebody has heat, you bleed up a point and you really try to find the best point location to let the blood out. And the blood should be bright red, and that lets heat out of the body. That's what we do on Jing-Well points, and that's what we do on UB40. For example, if someone has summer heat stroke, you can bleed UB40, and there you try to find the best location of the point, and you just prick, 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 and let the blood come out. Maybe you cup. Anyway, that will remove heat. But the other reason for bleeding is blood stasis. And in blood stasis, generally you're looking for little woe vessels. You can't really see what's going on here, but there is some purplish looking area over there. It's hard to tell, but you would, instead of looking for the exact point, you would look for the little woe vessels. And when you let that bad blood out, that helps enable good blood to flow through the area where it's been obstructed. So to clear heat, you bleed the exact point and look for red blood to, heat in the blood. And to move blood stasis, you look for little woe vessels, little spider veins and stuff like that. And you bleed it and you expect dark blood to come out in the beginning. And you're not, even if you're doing it in the UB40 area, you're not really looking for the point UB40. You're looking through the area for the spider veins. Anyway, so here's a story involving bleeding from Zhenzhou Dacheng. Tang Emperor Gaozong had a headache. And so his doctor was, doesn't say, oh yeah, this Dr. Qin was one of his doctors. And he said, we should prick Du20 to bloodlet. I picture bleeding Du20 kind of like if you have a pressure cooker and then there's this steam release valve on top. Bleeding Du20 is like letting off the steam of a pressure cooker. So his wife, Wu Zetian, Empress Wu Zetian, said, oh, how could you, bleed? How could you make the emperor bleed? That's disrespectful. But they did it anyway and let a small amount of blood, and Gaozong immediately recovered. Just an aside is Wu Zetian became the only ruling empress of China ever, the only one that was actually ruling in her own name. Well, so this is my last slide for this one. Besides this, I think I told you many famous herbalists use bleeding and moxa, even though they rarely or never use acupuncture. And I mentioned some of these before. Dozai wrote Bian Cui Xin Chu, and Wang Tao wrote Mai Tai Mi Yao, and Shuiji wrote a number of books, and Judan Shi, one of the four great masters of the Jin Yuan dynasty, also used moxa and also used bleeding, but I haven't found any cases where he actually used acupuncture, or in his books, he doesn't really talk about doing acupuncture with a fine needle. Just in case you're curious, the old books don't usually discuss cupping or gua sha. I believe they were considered folk medicine at the time, and scholar physicians didn't use them. And scholar physicians are the ones that wrote books and left that record. So little by little, they became more accepted. And so now, acupuncture books will also talk about cupping and or gua sha. Sorry, but the old books don't really talk about that, almost never. Okay, so that's this one. I'm going to do one more of these, talks about what did Acumoxa look like in the old days. And I'll be talking about point indications and did they use point functions and, this kind of stuff. Okay. Okay.